But if you do the math, I mean, if this becomes a common therapy, there will not be enough donors to make human serum. So you run out of that. I mean, as one example. So does that mean that we have to go back and do another registration trial, or will the FDA allow a change in manufacturing? So that way you would encourage innovation in pharma and biotech. You know, standardly there's, you know, the blocked innovation, you know, because you want to have a monopoly. But here we have this rapid drug cycle happening with much more powerful cars than we had 5 years ago. And the patent life won't matter. It used to.
Yeah.
But now the drug development cycle is going to be so rapid that innovation is going to drive it, just like the cell phones. So the FDA has not ever had this challenge, I think, where the innovation can happen so rapidly, and I think we're going to see issues of, for instance, one of the issues we found is, you know, with leukemia, the one resistance mechanism has been that the target can be, the target's called CD19, and that can come off the leukemia cells genetically, they can, and then escape. And then now we can make what we call CAR pools, where we have pools of CARs targeted against different molecules, and then that eliminates that as a problem. But, you know, how do we encourage the company then to put itself out of its own product? You know, and so the FDA is going to need to have new ways to regulate cell therapies. It's going to have to come from both engineering sciences, which will get better and better, and then maybe, you know, one of the big unknowns I mentioned is whether these third-party cells and how, where they'd be safe and will they work, and then the other I think is, will there be point of service? Right now, you know, all the big pharmas are doing car manufacturing at central pharma manufacturing plants and then shipping back. But, you know, will it happen where they end up being done like with the Red Cross and at local blood centers? And that would really make the logistics much easier.
Yeah, yeah. And I think there are people in this room,